Role and indications of postoperative ventilation. Postoperative ventilation is the process of providing mechanical respiratory support to patients after a surgical procedure. It is employed in specific clinical scenarios to ensure adequate oxygenation and ventilation, prevent respiratory complications, and support the recovery process. Below is a detailed discussion of its role and indications. Role of postoperative ventilation. 1. Respiratory support. Postoperative ventilation ensures that the patient's lungs receive adequate oxygen and carbon dioxide is effectively eliminated, especially if spontaneous breathing is insufficient. 2. Hemodynamic stability. By maintaining optimal oxygenation, postoperative ventilation helps stabilize cardiovascular function, which can be compromised during surgery. 3. Reduction of work of breathing. After major surgeries, patients may have reduced respiratory muscle strength or impaired ventilatory drive. Ventilation decreases the effort required to breathe. 4. Prevention of atelectasis. Prolonged intubation and mechanical ventilation help prevent alveolar collapse, particularly in patients with compromised lung function. 5. Facilitation of sedation. Postoperative ventilation allows the continuation of sedation or anesthesia in cases where the patient needs to remain unconscious for medical reasons, e.g., neurological monitoring. 6. Management of acid-base balance. Ventilation helps manage metabolic and respiratory acidosis or alkalosis, which may arise due to surgical stress or underlying conditions. 7. Support during weaning. For critically ill patients, postoperative ventilation aids in the gradual transition to spontaneous breathing through controlled weaning protocols. Indications for postoperative ventilation. 1. High-risk surgeries. Cardiothoracic surgery, e.g., coronary artery bypass grafting, valve replacements. Major abdominal surgery. Neurosurgery, especially involving the brainstem or cervical spine. Prolonged or complex surgical procedures, e.g., 6 hours. 2. Pre-existing respiratory conditions. Chronic obstructive pulmonary disease, COPD, severe asthma, interstitial lung disease, obstructive sleep apnea. 3. Cardiovascular instability, hypotension or shock requiring inotropic support, persistent arrhythmias, myocardial infarction or heart failure during or after surgery. 4. Neurological impairment, residual effects of anesthesia, postoperative stroke, severe traumatic brain injury. Reduced consciousness, e.g., Glasgow Coma Scale 8. 5. Failed extubation, inability to protect the airway, e.g., weak cough reflex, excessive secretions, recurrent respiratory distress following extubation attempts. 6. Pulmonary complications, acute respiratory distress syndrome, ARDS, pneumonia or aspiration during or after surgery, pulmonary edema. 7. Severe systemic conditions, sepsis or septic shock, multi-organ dysfunction syndrome, MOS. High intra-abdominal pressure, e.g., in abdominal compartment syndrome. 8. Postoperative pain and sedation, need for deep sedation due to pain or surgical requirements. Use of high-dose opioids causing respiratory depression. 9. Metabolic and acid-base imbalance, hypercapnia or severe hypoxemia. Uncompensated metabolic acidosis requiring ventilatory support. 10. Obesity and other anatomical challenges. Morbid obesity with decreased respiratory compliance, difficult airway management during surgery. Modes of postoperative ventilation. The choice of ventilatory mode depends on the patient's condition and clinical requirements. Controlled mechanical ventilation, CMV, for patients who are not breathing spontaneously. Assist control ventilation, ACV, to support weak spontaneous breaths. Pressure support ventilation, PSV, used during weaning phases. Non-invasive ventilation, NIV, for mild to moderate respiratory insufficiency when the airway can be maintained. Monitoring during postoperative ventilation. Arterial blood gases, ABG, to monitor oxygenation, ventilation, and acid-base status. Pulse oximetry, for continuous oxygen saturation monitoring. Respiratory mechanics, assessment of tidal volume, respiratory rate, and compliance. Hemodynamics, regular evaluation of heart rate, blood pressure, and cardiac output. Postoperative ventilation is a vital intervention in certain high-risk patients, preventing complications and facilitating recovery. It requires a multidisciplinary approach involving anesthesiologists, intensivists, and surgeons to optimize outcomes.